It knows just how far to go, and then it relaxes. And then you've got good, typically lifelong immunity. So that's one of the big concerns we have. About 70% of the population are allergic to PEG. Various scientists have approached the drug companies and pleaded with them in their research to check for antibodies before giving them the vaccine, and they wouldn't listen. And they know full well this data. Okay, so if you look at the Pfizer vaccine, what they did was they looked at roughly 44,000 people, split them in two groups, have got the, quote, vaccine, half for control. And you had about 162 people in the control group got symptoms of COVID, and 8 got it in the vaccine group. So this is what they call the 95% efficacy that you read about. Have you seen that? In the headlines, Pfizer vaccine, 95% effective, okay? So 95% efficacy is based on what's called relative risk reduction. Crunching the numbers, this is a 0.7 absolute risk reduction. So stay with me for a minute. So to understand this, if you have 100 people and 2 get a disease, that's a 2% incidence. Reducing that from 2 to 1 is a 50% relative risk reduction, which would be pretty good, right? Sounds good. That's a 1% absolute risk reduction, which is kind of a yawn. So in the Pfizer case, it was even less than 1%, it was 0.7. And if you look at what's called number needed to treat, you have to treat roughly 140 people for one to get benefit. Yes, sir?
Those 44,000 that they was in the study group, were they actively exposed to the COVID-19?
These were healthy people, which is another problem.
Just lived their life.
So they're healthy people. They randomized them, split them in half, gave half the saline control, the placebo, gave half the so-called vaccine, and then they just monitored them. And I know an MD who was on their experimental program, and he interestingly said they had trouble getting COVID cases. Now think about that. If this is the zombie apocalypse and people are dropping dead in the streets, and you got 44,000 people, how is it you have trouble getting COVID cases? And we're gonna vaccinate 7 billion people based on 170 cases? Are you absolutely kidding me? This is insanity.
Did they all 44,000 in the same town, city, where they, like, was it?
Good question. I don't know the answer to that. That's a good question. I don't know. They use, when they randomize things, they try to account for locale and all this kind of stuff. But they were using a positive COVID test. And that'd be a little, let's go down that rabbit hole for a second, because this is very interesting. Kerry Mullis, who got the Nobel Prize for PCR testing, which stands for polymerase chain reaction, said it was never designed to use to diagnose viral illness. So what they're looking for are little pieces of this messenger RNA. And by this manipulation or amplification process, they can detect very small amounts of this RNA-like material that they call a positive COVID test. Now, there's plenty of evidence, and you can find study after study, I'm not making this stuff up. After about 30 amplifications, the risk of a false positive just goes up exponentially. So a false positive is when you have a positive test that's not truly positive. A false negative is when you have a positive test that comes out negative. In other words, it'll show negative, but they're really positive. So if you do enough amplifications, everyone is going to have a positive COVID test. And I'll tell you, most of these companies do 35 and 45 amplifications. And guess what they did after January 1? Very good. Go to that a little bit. They dropped down the number of amplifications. So voila, we have less COVID cases. And a positive PCR test is not a COVID case. Well, what they keep blasting up on the news day after day, 400,000 cases, 500,000. Did y'all see the CDC in August said very quietly, they felt that the actual death from COVID, not death with COVID, death from COVID, was about 6% of reported. So at that time, I think it was about 200,000 cases, supposedly. So that was less than 10,000. Yes, sir.
How many people actually died in the vaccine trial?
None. No, there were no deaths. Which, that's a good point. That's kind of interesting, right? There were no deaths. So they basically had, they had some symptoms, maybe, the cough and the fever. You can tell COVID, you can make a diagnosis of COVID just by symptomatology. Number one, typically you don't have common cold symptoms. You don't have the runny sinusy stuff and the scratchy throat. Headache, fever, chills, exhaustion. That's pretty universal. You're whooped. Achy, maybe loss of smell and taste, dry cough. And most people, they get a sense. They go, I've had patients, they either like the fall of 2019 or early 2020 said, I really think I had it. And they would describe it and say, yeah, I think you probably did. Because I think it was in the subways in New York in the late 2019. So the virus, this is another argument. If you look up transmission of COVID, you'll see arguments that it's droplet only, and you'll see arguments for aerosol. And this gets to all the mask debate. From things that I've read, I believe the virus is also spread by aerosol, which gets around the mask, goes through the mask, and stays in the air for hours, who knows how long, weeks, days, I don't know, nobody knows. I'll bet every one of you in this room has been exposed. So the key is to keep your immune system strong. And I can tell you from personal experience, I had sinus surgery in June. I was only getting 3-4 hours of sleep. I was stressed, I was pushing myself, over-exercising. I came in on a Monday, and I felt like I was run over by a truck. I thought, uh-oh. And that night, the fever, chills, and things. 2 weeks sabbatical. So I knew what I had. And it wasn't because some COVID patient was coughing in my face. It was because we harbor there's trillions of bacteria and viruses. There's a whole ecosystem. So if you keep your immune system strong, you can resist stuff. I was growing up, we had 3 vaccines. Moms had measles parties. Kids ate dirt. You couldn't kill the kids. Do you know something that the CDC has said 1 out of 6 children has some sort of learning disability now. HHS says over 50% of children have some chronic illness. That is the elephant in the room. That is what should be on the front lines of the newspaper and the television. We're losing our kids. Like I said, Stephanie Stanov says by 2032, 2030, 1 out of 2 boys will be autistic. We're dying. We're being destroyed. And I think certainly toxins, poor food, a variety of things play a role, but I think vaccines have a big part. Okay?
Probably need to wrap it up.
So, yeah.
Because I know how long you can go.
So I've got other stuff. I'll stay as long as people want me to stay. I've got other slides I can show you. Oh, let me just scale real fast to the end and show you my little thing that I do.
Come back tomorrow.
Yeah. He could be here for a while.
I always tell my patients, strap in. People have been in my talks because I have a lot of stuff. All right. So this is my protocol. It's advice. It's not advice, just information. Okay. So vitamin A, I put people on 5,000 units a day. If a person is sick and they've not been taking vitamin A, I usually have them take anywhere from 50 to 100,000 once as a bolus. Vitamin D3, well, okay, 5,000 units a day, so it's easy to remember A and D, 5,000 each. Vitamin C, 500 to 1,000 twice a day. And zinc, about 30 milligrams daily. Now I carry a thing I call my cold sheet. Anybody wants it, I'll send it to them. I have this stuff called Argen 23. It's a silver hydrosol. This stuff is amazing. It kills everything. That means for 20 years you can nebulize it. I don't write scripts for antibiotics. My patients don't come in. It's amazing. So if somebody gets sick with COVID, which again, you can make that diagnosis quite easily. I'll put hydroxychloroquine, nebulized budesonide. It's a steroid. It'll cut down the inflammation in the lung. Ivermectin. It's interesting. It's a parasite malarial medicine that has some evidence. Puricori has some stuff out there. And Zithromax is an antibiotic, but also has antiviral properties. And then in my tough cases, I use IV vitamin C or IV ozone. My ozone teacher, Robert Rowan, cured 5 out of 5 Ebola patients in less than a week with IV ozone. Till he got a call from the Department of Ministry. And he said, this is a very interesting program, but we're going to have to put a stop to it. He was over in Sierra Leone. I mean, you talk about, and those are people, remember those movies, people bleeding out of every orifice? Yeah. So we have treatment. We can deal with this stuff. Keep your immune system strong, eat good food, think happy thoughts, get plenty of rest. You do not have to be scared. It's just, it's a viral bug. And believe me, there's going to be COVID 2.0, COVID 3.0. Didn't Bill Gates warn us there was going to be a worse virus this spring? Has anyone heard that one? Yeah. Dr. Bill, how did you know that? Anyway. So, yes?
I have one question. So when you had COVID, how long does immunity last?
Oh, excellent question. How long is immunity? We have no idea. But I'll tell you something. I would trust the immunity I have, having had it, than I would if I had gotten the vaccine. Because once you get a disease, you get over it, your body has the best immunity. I would debate that with any virologist.
I've been told by a pro-vaccinator friend that as adults, we should all probably be revaccinated with, you know, the like measles and all that. What is your thought on why that?
Because they don't work very well. That's why.
Okay.
The question was, why do we have to keep getting revaccinated? And if you look at the original work with vaccines, they said, oh, just give me 1 shot. There was 2 shots. Gates just came out, and I don't know why we even listen to a psychotic billionaire, but he came out and said he thinks it's going to be probably 3 shots. No, they're going to keep vaccinating. And well, I'll tell you something. When people got this so-called vaccine, start dropping from ADE, guess what they're going to say? We didn't realize how bad COVID was. We need more
Vaccines.
Exactly. So just be prepared to see that happen. If you have any loved ones, just a little piece of friendly advice. I think steroids probably could rescue them. Because if they get an overreaction, steroids will help to calm things down. So that's just, I don't have any evidence to back that up. Yes?
Is your old infirmed, is there much hope for them?
I have people pushing 90. Helen, who's been a loyal patient for many years, came in about 2 weeks after being exposed to COVID, so I gave her a little slap on the wrist for not seeing me sooner. And I could tell she sat there, I thought, Helen, you're going to get some IV ozone. So when Tabitha drew her blood, it was black. And her O2 sat with 94%. And she felt a little better, we gave her a second one, and then she texted me and said, I'm fine. So I don't care how old you are. You know, certainly as we get older, our immune systems aren't what they are when we're 10. And think of it, why do kids basically not get sick with COVID? And they don't even really transmit it. This is another thing that doesn't get talked about. This closing down the schools is just criminal.
Yeah.
They should open them up yesterday, and you know, masks. You know, if you believe solely in the droplet theory, you could justify masks, but I think they're spread by aerosol. Masks, there's increased incidence of bacterial pneumonia. You know, remember the Spanish flu, 1918? Killed all those millions of people? About 50 million people died of bacterial pneumonia. Now, certainly some of that was because of the flu bug, but masks were mandated, it was law. You'd be arrested if you didn't have a mask on. So when you're breathing this mask, you can build up bacteria, which multiply, and then you're breathing that back into your lungs and up your nose, can go up into your brain through the olfactory nerve. I mean, it's crazy. It's nonsense. Yeah.